Over the age of 70, the body becomes more sensitive to nighttime routines that once seemed harmless. And a recent case has drawn attention to how certain bedtime habits may quietly increase health risks. One common issue is going to bed immediately after eating a heavy or late dinner, which can strain digestion, worsen acid reflux, disrupt sleep quality, and place extra stress on the heart during the night when the body should be resting. Another risky habit is taking sleep medications or sedatives without proper medical supervision. As aging changes, how drugs are metabolized, increasing the chance of breathing problems, confusion falls, or dangerous interactions with other prescriptions. Sleeping in an overly warm room or using excessive blankets may also be problematic, since older adults regulate body temperature less efficiently, raising the risk of dehydration, poor sleep, or cardiovascular strain. Finally, ignoring symptoms such as shortness of breath, chest discomfort, severe snoring, or frequent nighttime awakenings can be dangerous, as these signs may point to underlying conditions like sleep apnea, heart rhythm disturbances, or lung issues that often worsen during sleep. While none of these habits guarantees harm, together they highlight how important it is for people over 70 to be mindful of their nighttime routines, prioritize comfort and safety, and consult healthcare providers when sleep patterns change. Because small adjustments before bed can make a meaningful difference in overall health and nighttime safety. Avoiding heavy meals or alcohol close to bedtime becomes increasingly important after the age of 70, because the body's ability to digest, regulate blood sugar, and manage cardiovascular stress changes significantly with age. As metabolism slows, large or rich meals take longer to move through the digestive system, which can lead to discomfort when lying down. Digestion requires increased blood flow to the stomach and intestines, and when this happens at night, it can place additional demand on the heart at a time when it should be slowing down and recovering. For older adults, especially those with underlying heart conditions, high blood pressure, or diabetes, this nighttime strain may contribute to irregular heart rhythms, shortness of breath, or disturbed sleep. Eating heavy meals late in the evening also increases the risk of acid reflux, a condition that becomes more common with age due to weakened esophageal muscles. When lying flat after a large meal, stomach acid can travel upward, causing burning sensations, coughing, or even silent reflux that does not produce obvious symptoms but still irritates the airways. Repeated nighttime reflux has been linked to chronic inflammation, disrupted sleep cycles, and an increased risk of aspiration, where small amounts of stomach contents enter the lungs during sleep. In older individuals, aspiration can be particularly dangerous because the cough reflex may be weaker and lung resilience reduced. Blood sugar regulation is another concern when heavy meals are consumed close to bedtime. After 70, insulin sensitivity often decreases, making it harder for the body to process carbohydrates efficiently. A large evening meal, especially one high in sugar or refined carbs, can cause blood sugar spikes during the night, followed by sudden drops. These fluctuations may trigger night sweats, rapid heartbeat, restlessness, or early morning awakenings. For people with diabetes or prediabetes, nighttime blood sugar instability increases the risk of confusion, dizziness, or even loss of consciousness during sleep. Alcohol consumption before bed presents its own set of risks. While alcohol may initially create a sense of relaxation or drowsiness, it interferes with the deeper stages of sleep that are essential for physical repair and brain function. In older adults, alcohol is metabolized more slowly, meaning it stays in the bloodstream longer and exerts stronger effects. This can lead to fragmented sleep, frequent awakenings, and reduced oxygen levels during the night. Alcohol also relaxes the muscles of the throat, increasing the likelihood of snoring and sleep apnea, conditions that are already more prevalent with age. The interaction between alcohol and medications is another serious concern for those over 70. Many older adults take medications for blood pressure, heart disease, anxiety, pain, or sleep, and alcohol can amplify their effects in unpredictable ways. Combining alcohol with sedatives or sleep aids may suppress breathing, lower blood pressure too much, or increase the risk of nighttime falls when getting up to use the bathroom. Even small amounts of alcohol can have outsized effects due to changes in liver function and body composition that occur with aging. Heavy Salty meals in the evening can also contribute to fluid retention and elevated blood pressure overnight. Sodium causes the body to hold on to water, which may worsen swelling in the legs and increase the workload on the heart. When lying down, this excess fluid can shift toward the chest and lungs, making breathing more difficult for people with heart failure or lung conditions. Some individuals may wake up suddenly feeling short of breath or needing to sit upright, symptoms that are often mistakenly attributed to anxiety or poor sleep rather than dietary timing. Another overlooked issue is how late-night eating affects the body's internal clock. The digestive system has its own circadian rhythm, and eating large meals late can confuse signals that regulate sleep and wake cycles. In older adults whose circadian rhythms are already more fragile, this disruption may lead to insomnia, early morning waking, or excessive daytime fatigue. Poor sleep quality over time weakens immune function, impairs memory, and increases the risk of falls and cognitive decline. Portion size and food composition matter just as much as timing. Meals high in fat take longer to digest and are more likely to cause bloating, pressure, and reflux when consumed close to bedtime. Spicy foods may irritate the stomach lining and trigger heartburn, while sugary desserts can cause energy spikes that interfere with the body's natural transition into sleep. Even foods considered healthy, such as large servings of fruit or whole grains, can cause discomfort if eaten in excess late in the evening. Hydration patterns also play a role. Heavy meals often encourage increased fluid intake, which may lead to frequent nighttime urination. For older adults, getting out of bed multiple times during the night increases the risk of falls, especially in low lighting or when balance is compromised. Interrupted sleep further compounds fatigue and reduces alertness the following day, creating a cycle that affects overall health and independence. The cumulative effect of heavy meals or alcohol before bed is not always immediately obvious, which is why the habit can persist unnoticed for years. Gradual declines in sleep quality, increased nighttime discomfort, and subtle cardiovascular strain may be attributed to aging itself rather than lifestyle factors. Over time, however, these nightly stresses can contribute to more serious health events, particularly in individuals with existing medical conditions, reduced mobility, or limited physiological reserve, making meal timing and alcohol avoidance a critical consideration. In later life, being cautious with sleep, medications, and sedatives is especially important. After the age of 70, because the body processes drugs changes significantly with aging. Liver and kidney function often decline over time, slowing the breakdown and elimination of medications from the body. As a result, drugs that once caused mild drowsiness can linger in the bloodstream longer and produce stronger, sometimes unpredictable effects. Even standard doses may become excessive, increasing the risk of confusion, excessive sedation, or breathing suppression during sleep. Many older adults turn to sleep medications because of insomnia, frequent nighttime awakenings, or anxiety about not getting enough rest. While these medications may offer short-term relief, they often alter the natural sleep cycle rather than restore it. Sedatives can reduce the amount of deep and restorative sleep, leading to lighter, more fragmented rest. This may result in daytime fatigue, impaired concentration, and reduced alertness, which can affect balance and increase the likelihood of falls or accidents. Another major concern is respiratory depression, a condition in which breathing becomes slow or shallow during sleep. Sedatives, especially benzodiazepines, opioids, and certain sleep aids, relax the central nervous system. In older adults, this relaxation can suppress the brain's drive to breathe, particularly during deeper stages of sleep. This risk is higher in individuals with sleep apnea, chronic lung disease, or obesity. Conditions that are common in later life and often undiagnosed, drug interactions pose an additional danger. Many people over 70 take multiple medications daily for heart disease, blood pressure, diabetes, pain, or mood disorders. Sleep medications can interact with these drugs in ways that intensify side effects, such as low blood pressure, dizziness, slowed heart rate, or irregular breathing. Combining sedatives with alcohol, even in small amounts, further amplifies these effects and can be life-threatening, particularly during sleep when warning signs may go unnoticed.